Treatments development. To obtain the proteins, peptides, growth factors, and polyphenols needed for each treatment, RCT's lab has to perform a more complex process than those used for stem cell therapies. Currently, our lab collects the bovine tissue in the embryonic stage and then homogenizes it. Next, we perform a centrifugation, discard the solid phase, and separate the liquid portion. RCT's ultrafiltration process allows the isolation of structures of a specific molecular weight. Using chromatography, we can separate and purify the desired molecules for the application, eliminating unnecessary biomaterial. We then remove the water by lyophilization and perform a microbiological control to guarantee the sterility of the proteins. Finally, it is ready for application on its intended pathology. Protein extraction. The proteins used in our treatments are obtained from bovine embryo tissue because of its low level of antibodies and high level of growth factors. This allows for versatility in many different cell culture applications. The embryogenesis consists of 3 stages. 1. Germinal stage, involving the conception. 2. Embryonic stage, when cellular differentiation occurs. 3. Fetal or growth stage. It is from the germinal stage that stem cells are obtained just a few days after fecundation. However, there is an important period in the second stage of embryo development, where every organ will define its functions after 3 to 4 months. In order for the stem cells to carry the information from the first stage to the second stage of organ specialization and then translate it, a production of growth factors is needed. The GF supplied will be responsible for the organ specialization in the embryonic stage. As a result, specific proteins and GFs can be produced during this specialization process. The molecules in the embryonic stage of the development are responsible for functions such as signalization, specialization, cellular differentiation, modulation, and reproduction, as well as the synchronization of all those functions. It is at this stage that these molecules have all the information regarding these important functions, which no longer exists in the pathological tissue. We know that damaged tissues do not regenerate properly through the mitosis and cellular differentiation process because of a lack of vital peptides and proteins being synthesized. The new proteins that RCT's lab isolates can provide the signals to stimulate, regulate, or inhibit functions of a targeted cell type. Tests reveal that when applying a new, healthy molecule from the embryonic stage into the related pathological tissue, all of its information will generate the specific responses needed in the pathological tissue to begin the restoration of function. This reanimation of cells has been observed in numerous patients, even after only a few applications of the treatment. The signaling information in the new protein is a fundamental reason why RCT is treating patients with the molecules produced in that crucial embryonic stage of the development. Specific organs and protein receptors. Another biological discovery revealed an important process in the embryonic development when the trilaminar embryo is formed, also known as the trilaminar germ disk. This developmental process occurs about 42 to 50 days in the germinal stage and is characterized by an embryo, which exists as 3 different germ layers, known as endoderm, mesoderm, and ectoderm. In each of these 3 germ layers, specific organs are formed in correspondence to the given layer, and each organ builds a different protein. For example, in the first germ layer, the endoderm includes organs such as the pancreas, digestive system, liver, lungs, thyroid, parathyroid, and thymus. Examples of growth factors produced in the first germ layer include growth factor IGF-1, which is generated in the pancreas, oxyntomodulin, which is generated in the digestive system, hepatocyte growth factor, or HGF, which is generated in the liver, fibroblast growth factor, or FGF, which is released in the lungs, T-activin, which is generated in the thymus. In the second germ layer, the mesoderm, the muscles, cartilages, bones, blood vessels, and organs of your urogenital system are developed, along with synthesizing of specific proteins and growth factors, including the EGF, VEGF, PDGF, MDGF, and FGF. The third layer, the ectoderm, forms the skin, central and peripheral nervous systems, the hypophysis, the eyes, tooth, hair, nails, and oral and nasal cavities. As in the other layers, every organ develops specific growth factors, and this layer contains NF, BDNF, NGF, GCDGF, and the growth hormone. All of these are specific proteins produced with enough information to be utilized for the treatment of a disease that causes cell failure in that related organ. Treating conditions on the molecular level allows the biological information to be communicated more effectively through signaling pathways when compared to stem cell therapies. For example, we can take a protein produced in the pancreas and apply it in treatments for the digestive system, liver, lungs, and thymus, because all these organs came from the same germ layer and will have the same receptors for this protein molecule. Results show that these proteins will favor the pathological organ and at the same time also favor other organs affected. This has been clinically verified, as some patients have improved from other diseases initially not targeted with the treatment. As we continue unlocking doors with our understanding of proteins and their functions, we will continue developing innovative therapies for common diseases. Currently, RCT can develop this treatment for diabetes, cancer, autoimmune or neurological disorders, circulatory problems, bone and joint problems, as well as for hepatic and renal failures. Patient preparation. Before a patient begins their treatment schedule, it is very important to have them clean out their body first, including cleaning the communication channels from one cell to another. Results show that a less toxic and more alkaline environment allows for better reception and absorption of the information carried by the protein. The detoxification of the body will provide the conditions for a faster and more effective response. This can be performed with the help of techniques such as ozone therapy, following RCT's personalized nutrition plan, hydrotherapy or salt baths, balancing pH levels to become more alkaline, cleanses that allow the body to drain toxins, increasing or starting daily physical exercises, eliminating toxin intake, such as alcohol and tobacco. All of these will prepare our body to process the treatment more effectively. Once detoxified, it is important to keep your body's environment stable during and after the treatment protocol in order to prevent the condition from returning and to maintain your new quality of life. All patients need to be committed to potentially adjusting their lifestyle and diet permanently in order to maximize the treatment's effectiveness for their own personal situation. RCT's scientists have seen very difficult diseases and the patients that withstand the terrible pain for many years. Often patients are told they have to live with the pathology indefinitely, but RCT is here to fight it. Treatment application. In order to improve your results with this innovative therapy, there are a number of precautions and steps each patient should take during the application of their custom treatment. RCT's treatments are distributed as a lyophilized powder inside small vials, sealed and quality controlled by our partner laboratory. Once received, it should be stored in a dry place that does not receive direct sunlight. You do not need to alter any current medications, as no adverse reactions with our treatments have ever been observed. Thus, if a patient is on any other treatment for their disease, then they can begin RCT's program safely at any time. It is also strongly recommended that patients do not stop taking the medication suddenly. Over the last few years of treating patients, it is found that some patients who had improved their condition after a few applications had unexpectedly stopped their treatment. Interruptions in the proteins, peptides, and growth factors being provided can cause the patient to quickly fall back into their condition. The routes of administration of the proteins can be intramuscular, intravenous, subcutaneous, or mesotherapy. Mesotherapy refers to the application of the protein directly in the area of the pain or around the source of the symptoms. For example, if the patient has osteoarthritis, the proteins can be applied around the knee area. However, the recommended method is intramuscular. Treatment schedule: 53-week program, 5 full-day visits during treatment period. Each treatment protocol varies depending on that patient's condition. RCT's innovative molecular therapy has shown extraordinary responses with treating several types of brain injuries, autism, ADD, Alzheimer's, and various types of dementia, diabetes type 1 and 2, osteoarthritis, rheumatoid arthritis, certain cancers, and autoimmune disorders. Our goal is to inhibit the progression of your disease and reverse the damage on a cellular level. However, the condition varies with each patient. This is not a miracle treatment. While some patients experience results quickly, others may require an extended treatment schedule, and a small percentage of patients may show little progress at all. RCT is able to treat such a wide array of diseases because its processes parallel the concepts of autologous therapy. In this respect, the methodology is that if there is available information being produced in specific areas of the body, you should use that information to treat the damage that is occurring.